essential vitamin for diabetic. Your doctor probably never told you this, but right now, for specific vitamins could be the missing key to finally getting your blood sugar under control. While millions of diabetics struggle with stubborn A1C levels and dangerous glucose spikes, a growing body of research reveals something shocking. These four vitamins work so powerfully that studies show they can drop A1C by up to half a percentage point / insulin resistance by 35% and protect your heart, nerves, and kidneys from the devastating damage that high blood sugar causes silently. The reality is simple, that if you are diabetic, your body burns through these vitamins at an alarming rate, create hidden deficiencies that makes blood sugar control impossible. Let's start with number 1, vitamin D. For millions of people with diabetes, vitamin D deficiency may be silently making blood sugar harder to control, and most never realize it. Why vitamin D matters for diabetics. Vitamin D is known as the sunshine vitamin, but for people with diabetes, it's far more than a bone nutrient. Research shows that vitamin D plays a direct role in insulin production, insulin sensitivity, and glucose metabolism. In fact, multiple studies have found that vitamin D deficiency is extremely common in people with type 2 diabetes, and low levels are linked with higher fasting blood sugar, poor A1C control, increased insulin resistance. A large study published in Diabetes Care reported that people with low vitamin D levels had a significantly higher risk of developing type 2 diabetes compared to those with adequate levels. How vitamin D works in the body. Number 1, vitamin D improves insulin sensitivity 35%. Vitamin D receptors are found in muscle cells, fat tissue, and the pancreas. When vitamin D binds to these receptors, it helps cells respond more effectively to insulin. A study in the Journal of Clinical Endocrinology and Metabolism showed that improving vitamin D levels enhanced insulin sensitivity, especially in people with insulin resistance and prediabetes. Number 2, supports insulin-producing beta cells. Vitamin D protects the pancreatic beta cells that increase insulin production up to 60%. Low vitamin D levels are associated with reduced insulin secretion, increased beta cell dysfunction. Research published in Endocrine Reviews confirmed that vitamin D is essential for normal insulin secretion and beta cell survival. Number 3, reduces inflammation. Diabetes is not just a blood sugar disease. It's also an inflammatory condition. Vitamin D helps reduce inflammatory markers such as CRP and cytokines, which improves insulin signaling, protects blood vessels, lowers the risk of complications. A meta-analysis in Nutrients Journal found that vitamin D supplementation significantly reduced inflammation markers in people with type 2 diabetes. Number 4, helps regulate calcium for insulin release. Insulin release depends on calcium movement inside pancreatic cells. Vitamin D helps regulate calcium balance, allowing insulin to be released properly after meals. Studies in diabetes research and clinical practice highlight vitamin D's role in calcium-mediated insulin secretion. Benefits of vitamin D for diabetic patients. Supports better fasting blood sugar. Improves insulin sensitivity. Helps stabilize A1C. Reduces chronic inflammation. Supports heart and immune health. May lower risk of diabetic complications. Food sources of vitamin D, diabetes-friendly. Natural sources. Fatty fish, salmon, sardines, mackerel. Egg yolks, moderation. Liver, occasionally. Fortified foods. Fortified milk or plant-based milk. Fortified yogurt. Fortified cereals, low sugar only. Studies show that diet alone rarely provides enough vitamin D, especially for older adults and people with diabetes. Sunlight and vitamin D. Sun exposure allows your body to naturally produce vitamin D. 15 to 30 minutes, 3 to 4 times per week. However, aging, darker skin tone, obesity, and indoor lifestyles dramatically reduce vitamin D production, making deficiency very common in diabetics. Number 2, vitamin C and diabetes. The blood sugar connection. Most people miss most common vitamins in your kitchen could help reduce blood sugar spikes. lower inflammation, and protect you from diabetes complications. Vitamin C isn't just for immunity. For people with diabetes, it may be a powerful metabolic ally hiding in plain sight. Why vitamin C matters for diabetics. Vitamin C, also known as ascorbic acid, is a potent antioxidant, but its role in diabetes goes far beyond fighting colds. People with diabetes often have lower vitamin C levels, even when their diet seems adequate. Why? Because high blood sugar increases oxidative stress, which rapidly depletes vitamin C in the body. Research shows that low vitamin C levels are linked to higher fasting glucose, increased insulin resistance, and greater risk of diabetic complications. A large population study published in Diabetes Care found that individuals with higher blood vitamin C levels had significantly better glucose control and lower diabetes risk. How vitamin C works in the body. Number 1, improves insulin sensitivity. Vitamin C helps insulin work more efficiently by reducing oxidative stress in cells, improving glucose uptake in muscles, supporting insulin signaling pathways. A randomized controlled trial in Diabetes Care showed that vitamin C supplementation improved insulin sensitivity and reduced fasting blood sugar in people with type 2 diabetes. Number 2, reduces blood sugar spikes after meals. Vitamin C competes with glucose for transport into cells. When vitamin C levels are adequate, less glucose enters cells uncontrollably, helping stabilize post-meal blood sugar spikes. Research published in Nutrition and Metabolism demonstrated that vitamin C supplementation lowered postprandial glucose levels in diabetic patients. Number 3, powerful antioxidant protection. Diabetes accelerates oxidative damage, which harms blood vessels, nerves, kidneys, eyes. Vitamin C neutralizes free radicals, helping reduce the risk of complications like neuropathy, retinopathy, and heart disease. A review in the Journal of Diabetes Research confirmed vitamin C's role in reducing oxidative stress and endothelial dysfunction in diabetes. Number 4, supports blood vessel and heart health. Vitamin C improves nitric oxide production, which relaxes blood vessels, improve circulation, lowers blood pressure. Studies in the American Journal of Clinical Nutrition link higher vitamin C intake to better vascular function and lower cardiovascular risk in people with diabetes. Benefits of vitamin C for diabetic patients. Helps lower fasting blood sugar. Reduces post-meal glucose spikes. Improves insulin sensitivity. Protects nerves, eyes, and kidneys. Supports heart and blood vessel health. Boosts immune defense. Best food sources of vitamin C, diabetes-friendly. Low glycemic sources. Bell peppers, especially red. Broccoli. Cauliflower. Spinach. Kale. Fruits, modération. Berries, strawberries, blueberries. Kiwi. Oranges, small portions. Whole foods are better than fruit juices, which can spike blood sugar. Vitamin C supplements for diabetics. Best forms. Ascorbic acid. Buffered vitamin C, gentler on stomach. Typical dosage. 500 to 1,000 milligrams per day. Split doses improve absorption. A meta-analysis in Nutrients Journal found that vitamin C supplementation significantly reduced fasting glucose and A1C levels in people with type 2 diabetes. Tip: take vitamin C with meals to reduce stomach discomfort. Who should be careful? People with kidney stones. Those with advanced kidney disease. Individuals taking iron supplements. Vitamin C increases iron absorption. Always consult your healthcare provider before high-dose supplementation. Vitamin C won't cure diabetes, but ignoring it could quietly accelerate damage inside your body. Sometimes, the most powerful support doesn't come from expensive supplements, but from restoring what high blood sugar has been stealing from you every day. Vitamin E in diabetes. The antioxidant that protects your nerves, eyes, heart, and blood vessel from the silent damage caused by high blood sugar. Vitamin E isn't just a skin or beauty vitamin. For people with diabetes, it may be one of the most important defenders against long-term complications. Why vitamin E matters for diabetics. Vitamin E is a powerful, fat-soluble antioxidant that protects cells from oxidative stress. In diabetes, chronic high blood sugar creates excessive free radicals that damage tissues, especially blood vessels and nerves. Studies show that people with diabetes often have lower vitamin E activity, even when intake appears normal. This imbalance may increase the risk of nerve damage, neuropathy, eye disease, retinopathy, heart disease, inflammation-related insulin resistance. A review in Diabetes Care reported that oxidative stress plays a major role in diabetic complications, and vitamin E helps counteract this damage. How vitamin E works in the body. Number 1, reduces oxidative stress. Vitamin E neutralizes free radicals produced by high blood sugar. This protects cell membranes, blood vessels, nerve cells. Research published in the Journal of Clinical Endocrinology and Metabolism showed that vitamin E supplementation significantly reduced oxidative stress markers in people with type 2 diabetes. Number 2, improves insulin sensitivity. Oxidative stress interferes with insulin signaling. By reducing this stress, vitamin E helps insulin work more efficiently, especially in people with insulin resistance. A randomized controlled trial in diabetes and metabolism found that vitamin E supplementation improved insulin sensitivity in individuals with type 2 diabetes. Number 3, protects blood vessels and heart health. Vitamin E helps prevent oxidation of LDL cholesterol, a key step in plaque formation and heart disease. Studies in the American Journal of Clinical Nutrition link adequate vitamin E intake with improved endothelial function and reduced cardiovascular risk in diabetic patients. Number 4, supports nerve and eye health. Diabetic neuropathy and retinopathy are driven by oxidative damage. Vitamin E helps protect nerve fibers, support retinal health, slow progression of nerve and eye damage. Research in the Journal of Diabetes Research suggests vitamin E may reduce nerve pain and improve nerve conduction in diabetic neuropathy. Benefits of vitamin E for diabetic patients. Reduces oxidative stress. Protects blood vessels and heart. Supports nerve and eye health. Improves insulin sensitivity. Helps reduce inflammation. May slow diabetic complications. Portion control is important, as nuts and oils are calorie-dense. Vitamin E supplements for diabetics. Best forms. Mixed tocopherols offer broader benefits. Typical dosage, 100 to 400 IU per day. Higher doses only under medical supervision. A meta-analysis in Nutrients Journal showed that vitamin E supplementation reduced inflammation and oxidative stress in people with type 2 diabetes. Tip: take vitamin E with a meal containing healthy fats for better absorption. Important safety note: vitamin E is fat-soluble and stored in the body. Excessive doses may increase bleeding risk, interact with blood thinners, cause digestive issues. Always consult your doctor before supplementing, especially if you take anticoagulants or have heart conditions. Vitamin E won't lower your blood sugar overnight, but it may protect your body from the damage high sugar causes every single day. Sometimes, controlling diabetes isn't just about numbers. It's about protecting your future health. Number 4, omega-3 and diabetes. The healthy fat that protects your heart and blood sugar. The fat you've been told to avoid could actually protect your heart, calm inflammation, and support better blood sugar control. For people with diabetes, omega-3 fatty acids may be one of the most misunderstood but powerful nutrients all. Why omega-3 matters for diabetics. Omega-3 fatty acids are essential fats that your body cannot make on its own. In diabetes, chronic inflammation, abnormal cholesterol levels, and increased heart disease risk are major concerns, and omega-3 directly targets all three. Research shows that people with type 2 diabetes often have low omega-3 levels, which is linked to higher triglycerides, increased inflammation, greater risk of heart disease, and stroke. A large review published in Diabetes Care highlights that omega-3 fatty acids play a key role in cardiovascular protection, especially important for people with diabetes. How omega-3 works in the body. Number 1, reduces inflammation. Diabetes is an inflammatory condition at the cellular level. Omega-3 fatty acids, especially EPA and DHA, reduce inflammatory compounds that interfere with insulin signaling. A meta-analysis in Nutrients Journal found that omega-3 supplementation significantly reduced inflammatory markers in people with type 2 diabetes. Number 2, improves lipid profile, triglycerides. High triglycerides are common in diabetes and increase heart attack risk. Omega-3s lower triglyceride levels by reducing liver fat production, improving fat metabolism. Studies in the American Journal of Clinical Nutrition show omega-3 supplementation can lower triglycerides by 15 to 30% in diabetic patients. Number 3, supports insulin sensitivity. While omega-3s do not directly lower blood sugar like medication, they improve cell membrane flexibility, enhance insulin receptor function, reduce insulin resistance caused by inflammation. Research in diabetes and metabolism suggests omega-3 intake may modestly improve insulin sensitivity, especially in people with high inflammation. Number 4, protects heart and blood vessels. People with diabetes are up to 2 to 4 times more likely to develop heart disease. Omega-3s help by reducing blood clot formation, improving endothelial function, stabilizing heart rhythm. A review in Circulation confirms omega-3 fatty acids reduce the risk of cardiovascular events, particularly in high-risk groups like diabetics. Benefits of omega-3 for diabetic patients: lowers triglycerides, reduces inflammation, protects heart and blood vessels, supports insulin sensitivity, may reduce fatty liver, supports brain and eye health. Best food sources of omega-3, diabetes-friendly. Marine sources, best absorbed: fatty fish, salmon, sardines, mackerel, anchovies, trout, tuna, moderation. Plant sources: flax seeds, chia seed, walnuts. Plant omega-3, yellow, must be converted into EPA and DHA, which the body does poorly, especially in diabetics. Omega-3 supplements for diabetics. Best types: fish oil, EPA plus DHA, most effective. Krill oil, better absorption for some people. Algal oil, plant-based option. Typical dosage: 1,000 to 2,000 milligrams EPA plus DHA per day. Higher doses only under medical supervision. A randomized controlled trial in the Journal of Clinical Lipidology found omega-3 supplementation significantly improved triglycerides and inflammatory markers in people with type 2 diabetes. Tip: take omega-3 with meals to reduce fishy aftertaste and improve absorption. Who should be careful? People taking blood thinners, those with bleeding disorders, individuals scheduled for surgery. Always consult your healthcare provider before high-dose omega-3 supplementation. Omega-3 won't replace your diabetes medication, but it may protect the organ most threatened by diabetes, your heart. Sometimes, the smartest way to manage diabetes isn't cutting fat, it's choosing the right kind of fat. If this video helped you out, please like, share, and subscribe our channel. I will see you in next video.